Hello, Dr. Fieno.
Hi, Caval. How are you?
I'm doing well. I want to know what you do. Where do you practice?
So, my name is Dr. David Fieno. I am an invasive surgical cardiologist at Heart South Cardiovascular, and I practice at Shelby Baptist Medical Center here in Alabaster. Now, we're lucky we have privileges at St. Vincent's Hospital as well as Grandview, and we have done some limited work at Princeton and Sylacauga, but our primary focus has been here at the Brookwood Baptist Hospital System, Shelby Baptist in Alabaster, Alabama. I'm part of a 12 physician group, and we are all board certified cardiologists. We love our patients, we love what we do. We all actually are very close, which means that we all have a similar practice motto, which is very simply do the right thing, and we want our patients to feel as good as possible and to have the quickest turnaround with whatever's bothering them. We also all have a real team approach. I'm really proud of the group that we don't have to fight with each other over patients. We tend to work symbiotically, and very often one of my partners will be taking care of a problem with one of my patients surgically or otherwise, and very often I will see my partner's patients for them. So we work together. We have one goal. We want you to get better. That's it.
That's great. Tell me more about your background. I hear you studied a little bit in California. I want to hear more about that.
Sure. Today is July 28th, 2022. I am 48 years old. I grew up in Cincinnati, Ohio, and studied engineering for about 10 years before I went to medical school. So went that route, worked in engineering for a long time, and I was lucky. I was able to work on several clinical studies and really became enamored with patient care. Rather than going to work as a professional engineer, I decided to stay on and go to medical school at Northwestern in Chicago and lived there for almost 10 years. And that was a wonderful experience. I still have the whip marks from that wonderful experience. It was a great school, not only because of the teachers that were there, but because of the students who were there, who really brought everybody up to their highest possible level and were competitive, but honestly not in an adversarial way. People all wanted everybody to be the best they could possibly be. Got tired of freezing to death in Cincinnati and Chicago, so as soon as I could, I moved to Los Angeles, California, where I was really fortunate to work with some of the greatest cardiologists that I had read about and heard of, but now I actually got to see in person. And I worked at Cedars-Sinai Medical Center, the West Los Angeles VA, and at UCLA. So I was out there for about 7 years, and I realized that Los Angeles was a great place. It was beautiful, a lot of great shopping, a lot of great entertainment. There were probably far too many cardiologists at that time, and from what I understand, that problem has persisted to this day. And in 2009, I started believing that my family needed a change of pace. We needed to be in a place where cardiologists were actually needed, and maybe in a more family-friendly environment. So moved to Hoover, Alabama in 2010 and started at Heart South Cardiovascular, and that's where I've been ever since. I am actually starting my 13th year at Heart South this summer.
Wow, that's awesome. So I'm sure in your many years of experience, you have seen some crazy cases.
Yes.
Are there any that come to mind that you can tell us about?
Sure. It's hard to just identify one. There's a patient who's become a dear friend who had a really unfortunate situation, but he had a cardiac arrest on the soccer field while he was coaching a group of kids.
Wow.
CPR was performed on the site. We were able to see him relatively quickly, and one of my partners put an extracorporeal membranous oxygenator, an ECMO, which is literally a heart-lung machine that now we can put in percutaneously without cracking open the chest. And we supported this young gentleman for a period of a couple of days, and we eventually realized that the widowmaker artery going to the front of his heart had a very tight 90% blockage. And so I mentioned a minute ago that the group works symbiotically. We all work as a team. So another one of my partners went in and was able to fix that 99% blockage. And gradually his renal failure improved, his pulses improved, his heart recovered, he got the tube out of his mouth, and neurologically, thanks to God, he was completely intact. So this gentleman and I became friends. I became friends with his wife and sort of got to know his family. I found out that he was an assistant preacher, and we ended up just getting to know one another over the course of the next year. Well, everybody thought this was behind him, and he referred a lot of his friends to the practice, and I got to know some of them, and they would always bring up this individual. Well, about a year later, he was doing great, but I told him because of the nature of that blockage that repeat surveillance testing was appropriate. In fact, where we started this interview, when I was in California with this type of blockage, patients got a surveillance angiogram every year just to make sure the stent was still open, because there was no room for it to go down. So we decided to get a stress test on him and an ultrasound of the heart. The ultrasound was completely normal. The stress test showed a terrible blockage, which was unbelievable to me. And sure enough, that stent was about to go down again, and this was a mere year later. So we got him to one of our local cardiothoracic surgeons who did a wonderful job. He unfortunately had to have bypass, then he had to have a repeat exploration of his chest for bleeding. He completely recovered, and to this day, he is doing wonderfully. He's got his, what I would say, 100% of his pre-arrest situation. He does not need a defibrillator. He does not have one. He is on all the right medications, and I see him actually once a year, and hope to maintain his friendship as long as I'm alive. And the two things I'll mention to you about this particular case is, in cardiology, the minute you think you know everything, you find out you don't. And that's the real takeaway for me, is if you think of something or you think something could be wrong, go ahead and get it checked out. And then the second thing that really occurred to me, especially when all these tubes were in this poor guy, and I mean, it just didn't seem like it was survivable, but never give up on a patient. And not that I ever would, but the patient will declare him or herself over time. And when you see this situation, whatever it is, if somebody's got a rash, if somebody's got a wound, if somebody's got a swollen leg, if somebody's passing out, pursue it until you feel like you find out what the cause is. And then once you find out the cause, get that taken care of. And that's how you treat the patient. And the last thing I'll tell you is just the depth of that relationship and the intimacy among the team members, and how everybody got together to take care of this fine gentleman in our community and his family. The intensity of those relationships and those bonds are very rewarding to me as a cardiologist, and I'm glad this one turned out well. But even when they don't, you really go home at the end of the day feeling like you've done something good and that you've given somebody the best possible chance, and luckily in this case it worked out.
That's amazing. So now, as a cardiologist, just like the heart, it's a complicated job. There's many components to it. What is your favorite part about being a cardiologist? What do you enjoy doing the most?
Wow. So the question is, what is my favorite part about being a cardiologist? Wow, that's a tough question to answer.
Sorry, I didn't mean to throw you further.
No, I have to say, I I look forward to going to work every single day. My mom once gave me a piece of advice. It's my mom's birthday today, by the way.
Happy birthday.
And hi, Mom, happy birthday. And she once gave me a piece of advice that was, do what you love and you'll never work a day in your life. Do what you love and you'll never work a day in your life. And I had been an engineer for almost 7-8 years at that time, and I decided to pivot and go to medical school. And this was, my father was always very supportive, but I think he was interested in me going down the engineering route. And I had many friends and mentors and teachers saying I was crazy, but I realized I did not love what I was doing as an engineer. And I had this drive that I had to see what it was going to be like to be a physician. And I have to say, I started it and I never really looked back. The beauty of the patient-doctor relationship, despite all the stuff that's happened, COVID and insurance and copays and legal issues and lawsuits and, private pay and all this situation, the beauty of the patient-doctor relationship is still not gone. And the fact that patients still look to you as their doctor and trust you to take care of them and their loved ones, and you have the privilege of that relationship with people, it's not something that's lost on me. And very often when I get done seeing a patient, I feel like I should have given them the copay, because that's how rewarding it is for me. I have one family that there are 4 generations that come to see me: great-grandmother, grandmother, mother, and daughter. And they all come to see me at the same time. They all come 4 for 1 visit. And it's one of these situations where you not only get to know the patient, but you get to know the dynamic in the family. And you feel like you can use that to best serve everyone. An example there might be, if you have the same problem among all 4 family members, you might use the same medication so that everybody can be on the same page with it. I think that the relationships that I have formed, and then secondarily, the relationships that I've formed with my colleagues in order to have one singular goal, and that is to take care of the patient that's in front of us. And then for me, later on, getting involved with things like pacemakers and blood clots and lead extractions and complex cardiovascular procedures, being able to draw on some of the engineering knowledge that I had and stay in touch with that component of my training has just been wonderful. And then the final thing I tell people all the time about cardiology is it is constantly evolving. What we're doing now is very different than when I started at Heart South 12 years ago. And that's very different than when I finished training, when I started residency and fellowship 10 years before that. Cardiology is something where we are constantly evolving, getting better, miniaturizing the equipment, becoming safer, having more of an awareness of things that make it safe. And there's something very rewarding that I know that next year this procedure is going to be even better. Here's going to be the next modification. And as a practitioner, as a proceduralist, I know that I need to keep my skills sharp so that I can continue to best serve my patients. And the last comment I'll make, I love the statement, I love the saying, standing on the shoulders of giants. People like Grunzig and Judkins, Swan, Gans, the thousands of cardiologists, to name a few, who have pioneered procedures that in some way perhaps I was able to build on, and maybe for my particular practice even make little modifications of that made it a little better. This concept that we can build on the amazing procedures that they did and then use that to take care of our patients, I still get excited about every single one. So it is, as the song goes, it's a tough job, it's still a job, but I have to say the practice of cardiology is and continues to be very rewarding for me.
That's awesome. That was a really, really good answer. So I'll ask this one final question. If I've never seen a cardiologist before, you as a cardiologist, what would you say to me?
So this is the important question for people out there. If I've never seen a cardiologist, what does a cardiologist say to that patient? What's different about my practice versus, say, a pulmonologist or an infectious disease specialist or a pediatrician or maybe a critical care doctor or a surgeon or an ER doctor? And cardiology, I will say, and cardiovascular diseases is a unique subspecialty of medicine. And one of the things that I have observed and that continues to be true to this day is cardiologists are first trained as internists. And so an internal medicine specialist sees you or anybody else for the first time, and we try to take a broad, sweeping survey of your entire life that first time we see you. So all the relevant questions: are you having problems? Have you had surgery? What vaccines have you had? What illnesses have you had? What are you feeling? What are your habits? Do you exercise? What do you eat? What do you not eat? What are you allergic to? Every one of those questions is part of that initial evaluation, and we draw on that skill. As the interview progresses, and believe it or not, we do all that in a couple of minutes with the help of our wonderful nurses and staff, by the way. After a couple of minutes, we go ahead and we say, well, how do we find out if the problems that you're having in part one, could they relate to the heart or could they relate to a blood vessel somewhere in your body? And of course, the answer is almost certainly they can relate to a blood vessel, because every organ in your body is perfused by some blood vessel. But very often it does trace back to the heart. A great example is one of the first symptoms of hypertension, uncontrolled or undertreated hypertension, is just shortness of breath that nobody can explain. And so very often we can provide some education about what that means, and we can tailor your evaluation to making you better through something that we understand. For example, beta receptors and beta blockers, common discussion with cardiologists and their patients, what they do. A lot of benefit. I've taken them myself, and definitely can be used to make someone actually feel better. And the next part of the interview and discussion will be, okay, where are you with your general health as it applies to your cardiovascular system? Have we made sure all your arteries are not blocked? Have we checked you for sleep apnea? Have we checked your cholesterol? Is there a role for exercise stress testing? Is there a role for imaging of the heart? And what would be the risks and benefits of each of those things? And at the end of the interview, we provide a plan with recommendations that we say, this is what we think you ought to do. And this is not only for the problem that you came in with, but for your general health. I like to tell patients, I don't want to throw the baby out with the bathwater. If I take care of your heart, but I fail to identify your high risk for a stroke that we could have done something about, I really haven't done my job. And then as time goes on, you find out the results of those tests, how your patient is doing, if they're getting better, and then what they can do in the future to minimize their risk. And that should be the kind of expectation coming in the door.
I love that. All right, well, thank you so much for your time. Is there anything you want to say before we wrap this one up?
It's my privilege, Kaval. Thank you for the opportunity today to do this interview, and I am honored and blessed to be a part of Heart South Cardiovascular, including all the staff members that work here. If you or any of your loved ones needs a consultation, please call 205-663-5775 or log on to our website, www.heartsouthpc.com, and we'll be happy to help you in any way I can. Have a blessed rest of 2022. Take care.